Right now I'm gonna palpate the tibialis anterior, which the origin will be the lateral condyle of the tibia and the proximal lateral surface of the tibia and the interosseous membrane. So it'll be right here. And the insertion will be the medial cuneiform and the first base of the metatarsal. And from here, I'm gonna do the dorsal pedal pulse, which will be off the first ray laterally, which I feel it right here. And now I'm gonna palpate the lateral calcaneal border will be right here. And then the navicular tuberosity, which will be like right here on the medial side, right here. And then I'm gonna do active range of motion. I'm gonna tell her to plantar flex on her own, which I'm gonna tell her to press down like if you're pressing the gas pedal. So press down. And then passive dorsiflexion. I'm gonna tell her to point her toes up to her nose, and I'm gonna add resistance. So there you go. And then I'm gonna do a muscle manual test on inversion. And then I'm gonna tell her to invert her foot, and I'm gonna place resistance. And the primary remover is the tibialis posterior. Secondary mover is the flexor digitorum longus and the flexor hallucis longus. And then I'm gonna do the geometry of eversion. So I'm gonna get the ankle and set it in the subtalar neutral. I'll place the fulcrum in between the malleoli. Stationary arm will go up the tibia shaft. Moving arm will go down along this second metatarsal. And I'll place the fulcrum here, and then I'll actually evert the foot, and normal range would be 15 degrees. Now I'm doing S1 neurological testing, which will be on the lateral ankle side. And this is for eversion of the foot. And then for reflex testing, I'll tap on the Achilles tendon right here. And then for S2, you're gonna lie down. And then it will be on the posterior side of the knee, coming down this way. And then it will be for knee flexion. And then I will tap on the bicep femoris muscle here, hamstring side, for reflex. Now I'm gonna tell her to sit down and do the Klager's test, which I would stabilize here, and then I will grab the calcaneus and the talus. I will put the foot on dorsiflexion, and I will rotate around dorsiflexion to test for semitendinosus, and then for the deltoid ligament, I will slightly plantar. Positive test would be pain in the medial side, and then also another positive test would be if I find not equilibrium and is slightly away from the talus. Implication would be medial pain would be from direct trauma. Deltoid ligament will include the anterior talofibular ligaments. For compression test, she's gonna lay back, and I will compress and squeeze the tibia and the fibula together, like so. And then positive test would either radiate pain in the fracture site, or when I compress, it will alleviate the pain, which also be a positive test of a fracture. And then for Homan sign, she's gonna stay like this, laying supine, and I will dorsiflex the foot. If she feels pain, it could be a sign of deep vein thrombosis. I could also squeeze here, but if there's a sign of pain, we should not squeeze. It will cause an embolism. And then for inversion talar tilt, come back down. I'm gonna stabilize here again. I'm gonna try to get the foot in a neutral position, dorsiflex, and I will invert the foot like so. And then for a positive sign would be it'll be greater than 10 degrees compared to the uninjured side, and also possible pain. And then the implication would be the calcaneofibular ligament and the anterior and posterior talofibular ligament.